Hello, good morning. Good morning, Nadem. Good morning, Aruna. So today, as we have seen that we are going to come out of this locking period, and we will be forced to go to hospitals for whatever reasons, even though we don't want to go for small ailments. So one thing we need to understand is, even when you go to the hospital, suddenly you will be seeing lot of changes which you have not seen before, because we in the hospitals have to follow strict guidelines, strict cleanliness, very frequent cleaning, and anybody who is going to be undertaking surgery, they need to know about consent for COVID-19 form. And most importantly, whenever you're going with your report to the hospital, see that you don't overcrowd the hospital. Go to the hospital only with one attendant, with files which is neatly packed. Don't go and display them there, or keep it up wherever you want, because though the hospital takes all the care to keep the environment clean, but even as a patient you need to take care of yourself. So most important, the moment you enter the hospital, there will be a triage area which says whether you have any symptom related to the respiratory diseases like COVID-19, or normal respiratory symptoms, or something which is unconnected to the respiratory system. You should tell very clearly where you stand. So if you are saying that I have everything, automatically you will come into a risk area. So you will be triaged into 3 areas and sent to places which are very safe if you don't have any of the symptoms which are related to this. So you should, when you come to the hospital, you should be very clear in what you are saying. And next thing is, don't be in a hurry. The moment it opens up, don't be in a hurry that I want to be the first to be operated, I want the first to get treatment. Have patience. The main reason is there are a lot of guidelines which have come up. See, like we need to do pre-operative testing and everything. So until unless we are very sure that you complete the criteria, we may not treat you. So we may not treat you. And sometimes whenever you have a slight respiratory symptoms, or there is some suspicion that you have come in contact with some personnel who had the disease, you may directly maybe asked to do a CT chest. So people will be surprised, what, I have just small symptoms and these people are asking a CT chest for me. But because the whole guidelines have changed, so the guideline says the most initial symptoms will be seen only on a CT. So like this, so many things, like when you have come to the hospital 2 months back and when you're coming now, there'll be a lot of changes. So be ready for it. Be consciously, take care of yourself. You should not come in to the hospital and get or catch up something which you are not supposed to catch up. So this is a communicable disease. So communicable diseases, we need to take care. Like we may be, see, always patients have a feeling that until unless a doctor touches the patient, the treatment is not complete. But now we are in an era where you try to minimize the contact with the doctor. So the thing is, we may be wearing a face shield when we are talking to you. So encourage yourselves to be on a teleconferencing with doctors. So when it's a must to meet us, that's the time you need to come to us. So otherwise, teleconferencing and communicating with doctors which you are very, with whom you are very confident with, and trying to minimize your visits to the hospitals, and of course investigations also when and when necessary. Always, when you are being evaluated very closely, as doctors, we know when you have to be investigated. So don't be in a hurry. Be slow with yourself and stay safe. So I think that is my advice for today. Nadeem, you want to say something?
Yeah, some people they have some symptoms, but they are hiding because in the fear of they are putting into
Quarantine.
quarantine. So can you just tell the people about that also?
See, for example, you need to understand that mild symptoms, it is like mild cold symptoms. Cold means cough, sore throat, and sometimes when you have some respiratory symptoms like, little difficulty in breathing. The problem, whenever you are having cough, at the same time you are having fever, that is a temperature, and slight breathlessness. When all three are there, you have to take, or you have to intimate to your general physician or people, because there are a lot of treatment which we can start. See, because when the treatment is started early, you come out of it alone. You need to understand the disease process, 85% of the people are going to have mild symptoms and they're going to come out. In the rest 15%, they may have some problems. And especially people who have problems like immunocompromised, like they may be taking steroids or diabetes or immunocompromised drugs, they have more risk of problems. So for them, they should take further care. Don't try to come out and expose yourself to the environment. So what we need to do is, and there is always people like who take medicines because somebody is saying, that also should be avoided. So majority of the people will come out very without any problems. So amount of complications which only 5% of the population really require treatment. Amongst the 5%, the only 2% have severe problem. That means going on to ventilate and all those things. So you should understand the whole statistics about the disease and act accordingly. Just because I am saying 85% of the population will be safe even after they get the disease does not mean you should go into the
Expose
society,
yourself.
expose yourself. That is not the thing. We really don't know whether we belong to the 85% or the last 2%. We don't know. So even young individuals are getting this disease, and because whatever their immunity we don't know, they are also having, and even young people less than 40 years are having a very bad result. So be careful. So first thing what I told you is, don't be scared. Whenever you think you have a respiratory symptoms, fever, cough, and difficulty in breathing, bring it to the notice of the doctor. Because a lot of calls I call that I'm having some discomfort, burning sensation, I want the test to be done. It's not like that. See, if everybody is being tested, you are going to a place where a lot of people with real positive cases are going to come. So please meet your confident physician, whoever you have, and talk to them. If the physician feels that you really require them, then go for it. It's not like rushing up just because you're going to get something done by the government. You cannot put pressure on the government, because the government also is taking lot of care. You do not know how difficult it is to come face to face. And when you are wearing a mask, for example, when I'm wearing N95 mask, I cannot even talk properly. I cannot even breathe properly. Majority of them don't know that. So it's not very easy. They are working under very great circumstances. And imagine, whenever you wear everything and go, half the time you are not able to move, difficult to move. Sometimes, your mobility is restricted, but still they are working under very great, difficult circumstances. So you have to help. You have to help doctors and the frontline people for taking care of you. So whenever you have symptoms like cough, fever, difficulty in breathing, then definitely you need to bring into information to your family physician. They will guide you, or to the hospital, whichever you are attached. And regarding the use of medications without doctor's prescription, they are dangerous, because there are a lot of things, lot of new things, and people just see and take them. Please don't take. So because taking all these medicines like HCG, azithromycin, they have caused lot of side effects to the people, especially, cause lot of cardiac problems. So please don't take any medicines without the consent of your physician. So whatever advices we are getting it, even we are following some guidelines in the hospital whenever we take any medicine. So please, without guidance, no over-the-counter medications, please don't take, and please don't harm yourself. Anything, Nadeem, you want to give back?
Yeah. Good. This is what we have to educate the people.
Yes. And coming back to our real intention of doing all these things, see, because still, even after the lockdown is over, still follow the same treatment, same modality of safety afterwards also. Lockdown, it is basically we are training ourselves. See, just because there is lockdown does not mean we are not going to have diseases in the future, because we are going to have. Sometimes, when people are allowed to come into the circulation, sometimes there may be a slight flare up, and sometimes, the government may again say, okay, we will again slow down by lockdown. All these are going to happen. We should be ready for it. So what is most important is, see, as individuals, when we take care of ourselves, indirectly, we are also helping the community. So the community means us. There's nothing but us. If we think, for me, it doesn't come, I will do whatever I want. That means you are putting the whole community at risk. So take care of yourself. If at all you have mild symptoms and you don't want your family member to get it. The best thing is, when you're having mild symptoms, be in a separate room, wear a mask in the house, use a separate toilet, you clean your room, you clean your toilet, don't allow your family members to come into that room. And even the food, they can just keep it and go away. Maintain at least 2 to 3 feet distance with your family members. So that way, even though you're having the mild symptoms in that 85% criteria, still you can keep your family safe, because there may be old people in your house who are immunologically compromised. So stay away from them. So don't bring them close. And there are a lot of studies which says young children, young people, because their immunity is less, they don't, immunity in the sense, the reaction to the disease is less, they don't present themselves properly. So because they don't present themselves, they can be the source of infection. So even children, you allow them to pay, but don't allow them to go to very close to very old people now. Usually in the house, children, young children are being taken care of by old people, grandparents. So the grandparents and children, because sometimes children can be asymptomatically, they can get the disease and go away. Keep the distance from them. So even in the house, all family members should maintain some distance, especially with the oral cavity, because when we cough and we talk, there will be some amount of droplets which will be coming out. So maintain a distance. So that minimum distance is very much necessary. And even the distancing, if at all you have mild symptoms, it may take about 2 weeks. It's not that you just 2 days you stay inside and come out. That's not correct. So follow the full quarantine, whatever the government has advised. If at all you are found to be mildly positive, and if they advise you have come in contact with somebody, when they request you to be in quarantine in the house, that does not mean you mingle with the family and trouble the whole family. Go in the house and quarantine yourself in a separate room so that you keep yourself distant from the family, because this is all basic education, and use your common sense and see that keep your family safe. Okay, Nadeem? And coming back to the joy of living at home, I think we will go to Nadeem, who will show us some of the activities which we can do in the house, in the lawns of your house, or wherever you have space, maybe in the terrace of your house, wherever you are comfortable, so that wherever there is no overcrowding. Nadeem, back to you about a lot of activities which can be done in the house.
Okay. Thank you, Lakshmi. See, basically, people say, "Jaan hai to jahan hai." So this is the time to keep ourselves fit. There are two reasons for that. Once you are fit, your immune system will go up, and you can fight with all the viruses. The second thing, when you are fit, what is going to happen is you are going to face the world very strongly. See, now a lot of financial challenges as people are going to face. People are going to face so many this thing. So they wanted to be physically fit to face all these challenges. So I'm just going to show you a few exercises which you can do at home at any time. Yeah, these exercises will be available on my channel, Nadim's Wellness. You can go and see there. Some more healthy. These are upper body exercises. The upper body exercise. Upper body means chest, lats, biceps, triceps, and shoulders. These are push-ups, which will strengthen your upper body, chest muscles. If you have dumbbells, you can use the dumbbells. Otherwise, you can use the water bottles. See, whatever available at home, you can do with those things. But it has to be equal in both hands so that you'll get the same strength. There is a resistance tube. With resistance tubes also, you can strengthen your biceps or any part of the body. And you can use the water bottles or you can use the dumbbells. all these exercises for your shoulders.
As a cardiologist, we would all.
Hello.
Yes, yes, yes.
Yeah, these are some of the upper body exercises.
Okay.
Tomorrow we can do the other parts of the, abs.
Body.
We'll do it tomorrow.
Okay.
So like that, we'll change.
You can come out of the screen.
Yeah. Every day we can do different exercises.
So see, most important is any activities which is possible, which are comfortable for you do. Whenever you are not comfortable, you can always stay low or do less. See, that's what I think. As doctor, we don't want any one of you to fall into any sort of problems. So Nadeem has shown you few simple exercises with simple weights available in the house, like water bottles. And you can I think tomorrow we'll also so that you can tone up your whole body and see that and sometimes whenever you're staying in the house, the floor is very soft, very slippery, so always be careful. And one more thing is, if at all you have to do any activities in the house, you're not going out, you can clean your shoes, and you can dry them up, like clothes clean, have a clean wash, and use the shoes in the house, so that you're not slippery. You can do more activities wearing the shoes rather than doing the same thing on barefoot. These are some of the advices from my side.
Yeah, if somebody wants any kind of help in terms of creating their own exercise program, they can connect me anytime.
Okay.
We can guide them, we can help them. We
Yes.
also doing an online training also to few
Yes.
people. If anybody want online training, we can help them out.
Thank you, Nadine. Thank you. Thank
Yeah.
you. Aruna, back to Aruna. So, like we have seen some of the very interesting diets and the immunomodulating diets which have been showing us in the last few programs.
Okay.
And to say, like, there was a lot of appreciation, the lot of things which are easily available and which everybody can follow. It's not that very difficult.
Yes.
So I think we are ready for another surprise from you. I think you can go ahead.
Yeah. So today I will talk about special immunity drinks. And as you rightly said, this is not going to be only for the lockdown period. It's going to be throughout our life, like how long the virus is going to stay, that long it's going to be like that. So we have to be very careful, and it's going to be a part of your lifestyle. Okay.
Yes.
So whatever you're eating, it's not going to be, or drinking, it's not going to be a temporary thing. And you just finish it off like that. It's not like that. Just a minute. So main thing is, I would like to stress on the point that it's going to be a lifelong thing and a lifestyle based thing, because we are getting different kind of pictures, viruses into the picture. People are saying that, experts in the field are saying that we are going to get it every 5 years, a new virus is going to crop up, or every other 2-3 years, the coronavirus may come back till we find a vaccine. So we are hearing so many things. So it's always better that you stick to the, one second, I'll make it as a screenshot, slide screen.
Next one, not that next. Okay.
Yeah. Okay.
Yeah.
So
yes.
The first thing is, can you see it now clearly? The whole screen is visible.
Yeah.
So
very clear.
Okay. The most important thing is, you have to understand you have lifestyle change now. Life is going to be before Corona and after Corona. This is very, very, very clear. So we have to alter our lifestyle change and make a change like so that, you know, every time you expose yourself to the community or you have to go out for your work or whatever, you follow the guidelines, what Dr. Lakshmi said. And when it comes to exercise, what Nadem said, and when it comes to diet, definitely these are going to be a part and parcel of your dietary lifestyle changes. So what I have around 4 drinks, I have prepared recipes. So whatever is possible for you within your lifestyle, you can definitely change and at least try to drink at least 1 drink a day. So the first thing is a ginger pepper drink. So this is for 3 people, okay? Suppose you have 3 people in the family, you can make this drink. You have 2 tablespoons of black pepper, 1 tablespoon ginger, 1.5 teaspoon of soap, and 1 teaspoon jeera, and again 1 teaspoon of coriander seeds. Now what do you do with this? You dry fry all the dry ingredients and then add these 3 cups of water, bring it to a boil, allow it to boil for, you know, very short time, just 2 to 3 minutes, and then you can start drinking it. My advice is also that you stop drinking coffee, tea, and you can switch to these kind of healthy drinks so that you can even make the powder and keep in the kitchen. Suppose it's a ginger pepper drink. You can make dry ginger instead of wet ginger and make this drink and keep it in your kitchen. And just like how you make your coffee, tea every day in the morning, you can certainly make this kind of a healthy drink and have it throughout your life, which is going to definitely increase your immunity. So the second drink is tulsi drink. All of us have tulsi plants. Most of us have tulsi plants in our balconies or in our gardens. So we can utilize that now. And there is an Ayurvedic concept saying that tulsi actually regularizes hormones. So women were asked to circulate around tulsi, not for religious reasons, but so that leaves actually regularize your hormones. So why not utilize that tulsi also in your drink? So this is for 1 person, this quantity what I've given. Suppose you take a cup of water, add half a teaspoon of dhania powder, half a teaspoon of, this is more like a kashayam, half a teaspoon of jeera powder, half a teaspoon of black pepper powder, just a pinch of cinnamon powder, and add in the end a few fresh tulsi leaves. Again, dry fry all the dry ingredients, and then you add the tulsi leaves in the end to the water, and you have it. Trust me, it's going to be a fantastic mood enhancing drink also. And you know what? Most of us have GI disturbances also during this time because we don't sleep well or eat properly or lack of enough exercise. So these kind of spices also regularize and help and aid in your digestion better. So the second drink is the tulsi drink. For those of you who have this lovely plant in your house, you can go ahead and try this drink. The third thing, my favorite, this is actually my favorite drink because I feel coconut is something God has given us. It's like a gift. This is a coconut milk drink. See, adults, generally, it's better you take coconut milk instead of regular milk. So go for coconut milk, 2 cups of coconut milk. Coconut milk can be gotten very easily. Just grind coconut, add some water, and then you get coconut milk. In a blender or in a mixer, you get fantastic homemade coconut milk. So that part is done. So this, you take 2 cups of coconut milk, add 1 teaspoon of freshly grated ginger. I think it's already very appetizing when you listen to it itself. And then 1 teaspoon turmeric powder and 1 tablespoon of freshly grated. This is like this. You either take 1 teaspoon of turmeric powder, and if you're lucky enough to get 1 tablespoon freshly grated turmeric root, you can grate that. That is even better. So during the lockdown, definitely we cannot get the turmeric root. So we can go for the teaspoon of turmeric powder. After the lockdown is lifted, these kind of things we can go for because this drink and this lifestyle is going to be a part and parcel of our life. And the third ingredient is 3 to 4 peppercorns. Tell me, these are so easy to get and very, very simple and accessible. You can make a fantastic immunity drink out of this. And coconut milk is very, very, very smooth on your system also. And you know, it's supposed to regularize the stomach acid contents also. So have it every day and have it with this ginger, turmeric and corn. It's going to be a very, very appetizing and beautiful drink. And if this need not be boiled or anything. You can just take it just like that. So this is another option you have. And finally, every grandmother in the house or every amama or nanama, everybody, they'll tell, if you're having cold, just take turmeric milk. So this is an age-old Indian thing where you're supposed to take turmeric milk so that you can fight against the cold, cough, or any kind of viral attacks. So how do you make the turmeric milk? So this generally I advise for children or anybody who's less than 18 years of age. So those who are above 18 years can definitely go for the coconut milk, and lesser like kids or adolescents or early or late adolescents, they can go for turmeric milk. How do you prepare the turmeric milk? Very easy. Just boil the 150 ml of milk, add half a teaspoon of turmeric powder, 1/4 teaspoon of pepper powder, and don't forget add 1/4 teaspoon of coconut oil. So actually you have a 2-in-1 thing in this, because when you add the coconut oil, you're actually increasing your immunity also. And kids generally don't like to drink oil or any such things. So when you add it with milk, it becomes very flavorful and it becomes very tasty. So this is again something which you can give in the night, because if you want your children, because they don't have school or they don't have any activity planned for the next day, they might be sleeping late. So if you give this at around 6:30, 7 o'clock, they will definitely go to sleep early also, because it acts as a superb, sleep inducing thing. So you have 4 options now. My preference is the coconut milk, and I would give my child turmeric milk. So you decide what you like, the ginger drink or any other drink, and you can go for that and make it a part of your life. Trust me, this is going to be an ongoing fight. So immunity is not a one-day affair. We are not going to do something today and then forget about it tomorrow. It's going to be a continuous and thorough thing throughout our life. So make something which you can do every day. Lifestyle changes means that is something which you can follow every day, and not just you do for a week or 10 days or a month and then you get back to your regular routine. So incorporate any of this milk or any of this drink into your diet every day, and make it a part of your life and enjoy the benefits that these can give you.
Thank you, Aruna. It was a beautiful and it's a lot of eye-opener for all of us. So how easily we can prepare things, which is what is available. And it's a very, all look like very happy drinks.
Very simple, yeah.
Very happy and very curious drinks, which every one of us will want to go and immediately try it. So like, according to me, as a professional in this field for almost more than 25 to 28 years, I can only tell what's happening is, this is the time where we need to get ready for a war which is coming ahead. So when I say war, it does not mean like little bit of unpredictability which is going to come. So it's all a time for us to sit in the house and think like how we can protect ourselves, protect the family, and how we are going to lead on. So now for the next 6 months, it'll be more about, sustaining yourself, keeping you safe from the disease, and see that, like you don't fall into any sort of a trouble. Now, the economics of our lives comes later. So because economics of our life will always play a role, but at this point of time, health, and health. So that is the most important thing, and the rest of the things will automatically follow. Aruna, you want to say something? Sorry.
See, we are always like, we are saying the government is giving a lockdown, has put us under a lockdown and stuff like that. I would like to add one very important point, that, the onus is us. The onus is also on us. See, when we go out, we have to practice social distancing. We have to do everything so that, you're socially responsible and you don't spread or get the infection from anybody. So it's in our hands. End of the day, what we touch, what we do, how we move around, how we go into the society is 100% dependent on us. So definitely we have to take that responsibility. And I feel 70% the onus is on us. You behave in a responsible way, you're not going to spread the infection. At the same time, you're not going to get the infection also.
I stand with you, Aruna. See, that was the main reason why I started this program with all of us, because I was feeling that everybody thinks somebody has to take care of ourselves. See, why we are not doing what we are supposed to do. Exactly. Even when you see, for example, a vegetable vendor comes into your place, comes into your vendor, ask people to stand at least 6 feet ahead. Why everybody will go and fall on him? Exactly. You see a milk packets buying, you see lot of people going and at a time falling in the shock. See, where is that common sense? See, basically, see the government, the prime minister, chief minister, guiding us so nicely. Do this,
Very
do
true.
this,
Yes.
and if we are not able to follow the simple guidelines, what they have said, then where do we stand? So my thing is, not only you do, whenever something is not going on right
Question.
on your side, you just request them and don't fight with them. Request them and educate them so that I think we can all live in a very good society and a good community where everybody are safe and healthy. Thank you for today. Yes, Nadeem, you want to say something? Nadeem?
As all of you are saying, it's a teamwork. We had to
Yes,
educate
yes,
people. We had to take our own responsibility.
yes,
We had to win against all the challenges as a team.
yes,
So thank
yes.
you. It's a nice program today.
Yes.
Thank you, thank you,
Thank
thank
you.
you,
Thank you.
thank you, thank you.
Okay.